Well, the results of a new study could save your life by helping doctors discover cancer even earlier. It claims that a simple blood test could help detect lung and prostate cancer in its early stages. The American Society of Anesthesiologists says its research could also help determine the success rate of tumor removal surgery. Let's talk about it with Dr. Otis Brawley, the Chief Medical Officer for the American Cancer Society. Dr. Ernest Patti is also a face you know. He's a senior attending physician of emergency medicine at St. Barnabas Hospital in the Bronx. Welcome to both of you. Dr. Brawley, it is said to be a fairly simple blood test. Why has it just been discovered now?
Well, you know, there are many of these things out there, and it actually needs to be refined and worked on still. This is not ready for prime time, probably 5 or 6 years from actual use, if it's ever going to be useful. But I would remind the public we've had a number of blood tests in the past that we thought were going to be useful for the diagnosis of cancer, and they turned just not to pan out.
Dr. Patti, are you excited about this research?
I'm very excited, especially from my perspective as an emergency physician. Imagine if we had these types of tests at our disposal early on when a patient presents to the emergency department, and we could give them that information in the beginning and say, look, you're at a higher risk for these types of cancers. It would be wonderful. Get them in for earlier treatment and hopefully prevent further consequences.
Apparently, Dr. Brawley, they're looking for serum-free fatty acids and some other metabolites. Give us a layman's explanation. What are they looking for, or what do they see in the blood?
Yeah, fatty acids are actually chemicals that are always in everyone's blood. People talk about cholesterol, for example. That is a fat that's in the blood. These particular fatty acids seem to be higher in people who have lung cancer. Now, one of the reasons why I say this is not ready for prime time is when they do this test on people who have lung cancer, about 70% of those people actually have a positive test. About 30% do not. When they do this on people who don't have lung cancer, about 75% have, there's still some problems in terms of accuracy, but this is a great lead and it needs to be followed up on.
Also, prostate cancer, Dr. Patti, that's a very common cancer in men, but it's not always fatal, and it's not even always problematic necessarily.
Well, that's true. Many times it's not picked up until much further along in the patient's lifetime and further along the development of the cancers. So if we can pick it up early, maybe we can catch those types that are aggressive and start treatment earlier and prevent these men from having complications that normally befall them when they have far advanced types of prostate cancer.
So, Dr. Brawley, you look for a time, maybe you say five years down the road, when they would be able to take this research, hone in on it a little bit, and come up with a better test that's more reliable?
That's right. We need a better test that's more reliable for discovery of disease, and in the case of prostate cancer and in the case of lung cancer, we need some genomic tests that tell us the cancers that need to be treated versus the cancers that need to be watched. Right now, in the case of prostate cancer screening is a huge question mark about whether it's reliable and beneficial, because we cure a whole bunch of men who don't need to be cured, and the cure can be substantial in terms of morbidity.
Yeah. Sometimes the cure is worse than the disease, or so I understand it. Dr. Otis Brawley, Dr. Ernest Patti, thank you both.
Thank you very much.
Thank you.